Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I'm very excited to be introducing my guest, Dr. Karen Kaufman. She is an allergist, immunologist, and the founder and owner of her thriving solo practice in Northern Virginia, Kaufman Allergy, Asthma, and Immunology. Dr. Kaufman provides the highest quality of care to children and adults while practicing medicine on her own terms. She is a great listener and a compassionate problem solver who helps patients get the answers they need and feel well again like they deserve. So welcome to the show, Dr. Karen.
Thank you. So good to be here. Thanks for having me.
My pleasure. So we are going to talk about running with allergies, and many of us have seasonal allergies, and if you live in the Northeast, allergy season is definitely upon us. I have a lot of runners who tell me that they take their training indoors to the treadmill when allergy season comes about, and I am someone who loves to run outdoors, and I only use the treadmill as a last resort. So I wanted to bring Dr. Karen on to talk about how we can still be comfortable running out there in the middle of allergy season. So that's what I'm going to open it up with that. Dr. Karen, tell us maybe what are some symptoms people come in with this time of year?
So here in Northern Virginia, it's probably not a whole lot different than where you are in Philadelphia, in that we are about 2 weeks into the early part of our tree pollen season. And as you can kind of see outside around you, we're starting to see those little buds popping onto all of the, those wintry branches that we've been used to seeing for the last several months. So with that, we are now starting to see a lot of symptoms coming into the office. And even right now, I'm taking a little pause from my son's baseball game, and they're feeling it right now too. And the parents on the sidelines have all of their questions about their other kids, and everybody's really starting to feel it. So what we're seeing this spring is not so different from what we see many years in the springtime, which is a lot of runny nose, nasal itching, sneezing, congestion, and tons of eye symptoms. So itchy eyes, ocular tearing, redness, and even kind of that puffy appearance of the skin around the eyes. And I know, I've caught my son doing this a lot, where he's just kind of rubbing. Yep. And it's like, he's just trying to alleviate that itch, but of course we don't want to rub. So yes, so that's a lot of what we're starting to see. I'm seeing also a lot of increased asthma symptoms. So for our asthma sufferers, coughing, shortness of breath, chest tightness, as these athletes are experiencing their pollen now that the weather is starting to get a little bit warmer. We're still a little chilly, but it's getting a little nicer, a little warmer. And of course, all of our spring activities, including running, are getting us outside.
Yeah. A lot of my patients are coming in with allergy problems, but asthma flares because of allergies as well in pediatrics land. So yesterday we had a really nice day here, and in the morning, like the white and yellow stuff was flying around out there. And I thought this conversation is very timely. While I love to see the daffodils and all the flowers blooming and the end of winter, that always means like allergies are coming right next.
Yeah, it's coming, and give it another couple weeks, and like everything here in Virginia pretty much turns yellow green with all of the oak pollen that's going to be dusting us any day now, really.
Yay.
Yes, for sure.
Now, do you regularly recommend that people get tested for allergies? Or, I mean, obviously, if you're out there and you're having sneezing, runny nose, and itchy eyes, you're allergic to something. But as to what flower or tree or whatever else, is that a common question you get?
I do. And I think, the importance in testing is really to help, with targeted management. And so, I will say for all folks who have symptoms, probably only about 75% have allergies. Believe it or not, about 25% are non-allergic. So in the folks who have those allergy symptoms and maybe are taking some over-the-counter meds and aren't feeling better, those folks for sure should get tested, because the first question is are we treating the right problem? Is that really what's happening? Because if it's a non-allergic mechanism, then the management's going to be a little bit different. So, I think testing is certainly, indicated in that group. Otherwise, for the 75% of us with these symptoms who have environmental allergies, identification of the specific allergens has its benefits. So, of course, we want to start with, environmental control measures and targeted avoidances that, to me, the more stuff that we can do without taking medicine, we should certainly do that stuff. So we want to, start with that. Now, if we're talking about, springtime outdoor running and we're symptomatic, you can still do some of those environmental controls, whether you have testing or not. So there's that. Medication therapy, sometimes we want to, utilize targeted medications. So, certainly we always want to start with the simple stuff. And now a lot of that is available OTC. So we'll talk about that in a few minutes, I think, just to kind of, get started with like, well, what do you try first? Like, what are your go-tos to, give yourself relief? So, but beyond that, sometimes medications are needed by prescription, or more targeted therapies. So, identifying the trigger is going to be important in that regard. And then certainly in those who are really just, sick of having symptoms, or they're getting bogged down by taking all these medicines, or having an increased medication need, or maybe medication side effects, or, ineffective therapy because it's just not enough.
Yeah.
For those folks who really do want that improvement in their quality of life, allergy shots, which is allergen immunotherapy, becomes a really good option, because a treatment like that is going to really help to reduce symptoms, but also reduce need for medications and improve that quality of life. So I think, if you would consider, hey, that may be something I would be interested in, then yeah, you got to start with testing.
Yeah. No, that makes sense. You were talking a little bit about, I think, avoidance of exposure, or
Sure.
can you maybe give us a couple of tips in terms of, I don't know, maybe like running at certain times of day, or any gear tips you have for those of us who are still trying to run out there before we turn to maybe medications or allergies?
It's really tough. So I would say, wearing a hat is a good idea. Wearing glasses is a good idea, just to kind of keep your face kind of covered a little bit. Definitely helps. Through the course of the pandemic, of course, a lot of individuals have been, taking to wear masks outside. Of course, that's a little challenging with running, but, just reducing the amount of, pollen that we're inspiring is beneficial. There's not a whole lot, unfortunately, otherwise, though, aside from just wearing, adequate protective clothing to kind of keep the pollen off of our necks and our skin and things like that as much as possible. But really, for pollen, the environmental controls start when you go back inside. So, leaving your shoes at the door so you're not tracking all of that outdoor pollen throughout your household. Coming home and taking a shower right away, get all the stuff off of you. And sometimes if that's not convenient, it may be a good idea just to have a change of clothes, or to take your hat off, so that way maybe your hair, which has been covered underneath now, can, get that pollen clothing off and things like that. So that definitely helps. Wash your hands, wash your face, get the pollen out of your eyelashes and your eyebrows, and all of the places where it likes to stick. So that definitely helps. And then beyond that, I would say, the other piece of advice I have for pollen is, just to take a look at the filters that are used in your HVAC at home, and also the air filters that are in the car, and just make sure they're in good shape. We want to keep the outdoor stuff out as much as we can. So, even keeping the windows closed and running the AC tends to be a better move as the weather starts to get nicer.
Oh, those are great tips. I don't often wear a hat if it's not sunny. So that's
Yeah.
something definitely I should incorporate, because I never really, I guess I thought about pollen landing in my hair, and I think, oh, when I get home, I'll just jump in the shower, but it might be more helpful to not have as much in my hair.
Yeah. It's
and sunglasses to protect it from landing, I guess, on your eyelashes too.
You got it.
I mean, with the pandemic, I was running with like one of those neck gaiters for a while, but now that
Mhm.
it's warmer and yeah, I feel less less like I need to do that, but that probably would be helpful to inspire less pollen as well.
Yeah, it's
Back for
amazing
spring.
how much, yeah, it's amazing how much people describe the improvement with wearing a mask.
Yeah,
I mean,
amazing.
makes sense, but
Yep,
yeah,
yep, I know, but maybe not the most comfortable during a speed workout.
you got it.
And then as far as, yeah, we were touching a little bit on the over-the-counter medications. Any tips as far as what to try first, and maybe next steps to take if things aren't working?
For sure. So it really depends on what the symptoms are that are most bothersome. So, I like to start patients on a second generation H1 antihistamine, which now are, for the most part, they're almost all over the counter. And
Mhm,
these are going to be the antihistamines that are kind of your 24-hour med versus like one that you would take every 6 hours.
mhm,
So you're going to get much more longer lasting effect and much less side effect with these second generation drugs compared to the first generations like diphenhydramine, which is our old school, first generation. Second generation drugs, includes cetirizine, it includes loratadine, it includes fexofenadine, amongst others, and they're all fine. People ask me all the time, hey, Dr. Kaufman, what's the best antihistamine to take? And the right answer is whatever is the one that works best for you, because everybody metabolizes them a little bit differently. And so, we see variable effects person to person, but your antihistamine is going to be your best bet for symptoms of runny nose, sneezing, and itching. So
mhm.
these are the ones I kind of think of as the wet symptoms, like all the wet stuff, like the tearing, the itching, all the drainage. That's all gonna be helped by your antihistamine. Whereas something like stuffy nose or nasal congestion and what we call postnasal drip, which is the drainage that starts in your nose but kind of goes down, ends up back in the back of your throat. That stuff is best managed with your over-the-counter nasal corticosteroid spray. So fluticasone is kind of your prime example of an OTC product, but certainly there are others as well, including budesonide or nasal triamcinolone is another option. So there's lots of OTC corticosteroids. And with those, you do need to kind of use them with a little bit of regularity for them to kind of kick in
Mhm.
versus your antihistamine, which you could really use it with, 30 to 60 minutes of lead time and get decent effect.
Okay.
The last OTC group that I like patients to start with is a good ocular drop. And we have a lot better options, I would say, now than we had just a few years ago with the addition of some ocular antihistamines that used to be by prescription only that are now available OTC. And so there's quite a few options in this group. And generally my preference is going to be something like olopatadine, and especially in our contact lens wearers, because
Oh,
you can use that product once a day. And so you could use it like in the evening after you're done wearing your contacts for the day, versus something like ketotifen, which you can use upwards of 3 times a day. So some people prefer that because they like to kind of dose a little bit more regularly depending on what their needs are. And so those tend to be my preferred of my OTC ocular drops. So
yeah. Oh, that's great. Thank you so much. Maybe I'll make a list and I'll put that in the comments for everybody. But that's really helpful. And it's so nice that we have all of these options over the
yes,
counter
it is.
now. So,
You
and
got
then,
it.
yeah, I mean, how long do you need to, you were saying with the nasal steroid, that takes a little bit of time to start working, but like, how long should
About a
we,
week,
about
maybe
a
a
week?
week. Yeah,
Okay. Okay.
just a
And if
little lead time helps.
yeah. And if you're trying these things for like a week or so, or maybe 2 weeks, and you're not noticing, relief, then it might be time to make an appointment with Dr. Karen
The
or
other
your,
thing too
your
that
allergist near you.
the other thing that I would suggest that's really beneficial, also that's OTC, but it's non-medicated, is going to be your nasal saline. And
Ah,
so even just good saline flushing, I usually actually just keep that right in the bathroom. So when you come inside after your run, you wash your hands, you wash your face, you can use some nasal saline and just help to get all of that particulate out of your nasal cavity. I like to encourage my patients when they're just doing like a quick rinse like this to use a technique that I like to call the blast and blow. So, so you basically can use one of those, one of those saline preparations that comes in a little metal canister, and you kind of just spray a little bit. That's your blast into one side of your nose, and then you'll just remove the bottle and just blow your nose right down into the sink. That's the blow. And then you'll do the same on the other side, blast and then blow. And that just helps to kind of clear out a lot of that particulate that if we leave it in there is going to continue to cause us problems, throughout the day if
Yeah.
we're not clearing it. So yeah, so it doesn't have to be a full lavage like we think about like sinus lavage, but just getting that stuff out of your nose helps. So
Wow, this is
that's
great.
another thing you can get with TC. Yeah.
I guess I'm hearing like we have like three kind of categories. You've got like the avoidance, and then you've got what you got to do when you get back in the house after you're running, and then you've got the medications as well. So we've separated it very nicely. Thank you. Anything else you wanted to add maybe before we wrap up? Any questions that I didn't ask that I should be asking as an allergy sufferer?
No, I mean, I think that's the big stuff. So I would say, like, as we manage this as best as we can with, of course, the least amount of medications that we need, I would definitely not take off the list the opportunity to fix the problem, because when it comes to, the management of environmental allergies, it's not something that people tend to really grow out of. And it's not something that tends to get easier. So if you love to run and you can't wait until that weather warms up so you can kind of take the run from the treadmill back outdoors, but then you just dread it because you feel so lousy, fix the allergies. Like, it's just a problem that people don't have to suffer from. And so, you may want to reach out to your local allergist and talk about immunotherapy as a great management plan. And for very many patients, they have a lot of, fantastic success fixing their allergies and enjoying their life again, like they deserve to. Yeah,
that's great. Okay, and now tell everybody where they can find you, especially if they live, in the DC, Virginia area.
Yes, ma'am. So my office, Kaufman Allergy, Asthma and Immunology, is located in the Washington, DC suburb of Vienna, Virginia. And we are happy to accept new patients, and I care for children and adults, so people of all ages. And we run the whole gamut of not only, inhalant allergens and asthma, but also food allergies and eczema and people who have recurrent infections and all sorts of stuff. So, I would be glad to be of service to all of you. So thank you so much. And of course, you can always find me on social media. I'm on Facebook at Kaufman Allergy and on Instagram at dr.kaufmanallergy.
Love it. Oh, and I will leave those links below too, so everybody can find you.
Thank you.
Well,
thank you. This is so fun.
Thank you so much for joining me, and thank you for sharing all of your knowledge with us. I know I learned some new things that I need to put into my routine.
Glad I was able to help.
All right. Thanks everybody for listening.
Thank you.
Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.